CJ. Welcome to week 34 of your pregnancy. Today I'm going to talk about what's happening with your tiny human, some of the more common symptoms that you might be having, what symptoms are not okay, and if you stick around, I will explain why mental health is so important during pregnancy. At 34 weeks, your baby is now about the same size as either a cantaloupe or a soccer ball, depending on what app you're looking at. He or she is measuring 17.8 inches, that's 45 centimeters in length, and weighs between 4.4 and 5.7 pounds, that's 2.0 to 2.6 kilos. Developmentally, at 34 weeks, your baby continues to accumulate fat, which is what will keep them warm when they're no longer inside of your uterus. They're practicing sucking, swallowing, as well as breathing, which probably explains those frequent hiccups. The lungs are continuing to mature, and most babies at this point are starting to get into the head down position in preparation for delivery. So here are some of the more common symptoms that you may be having now that you're 34 weeks pregnant. Number 1, your fundal height, the top of your uterus, is now measuring between 32 and 36 centimeters from the top of your pubic bone. Number 2, fatigue. You are so tired. After all, you are making an entire human, and you're probably not getting a lot of sleep at night. Number 3, mild swelling in your hands, your feet, and even your ankles. Number 4, an increase in your vaginal discharge. It may be white, clear, it may be thin, it may have the consistency of egg whites. Number 5, leaking urine every time you make a sudden movement, like sneezing, laughing, or coughing. And number 6, carpal tunnel syndrome, numbness in your hands, especially if you work at a computer all day. That being said, here are the symptoms that you should not ignore. 5 or more cramps in 1 hour, water running down your leg that isn't urine, bleeding heavy enough to saturate a pad in an hour. If your baby is not moving like he or she normally does, if you are having the worst headache of your life, it won't go away no matter what you do. Changes in your vision, black spots, flashing lights, tunnel vision. If you have a burning sensation in your liver is located in the upper right-hand side of your abdomen, behind and below your right breast. And if you have a sudden onset of severe swelling, those are symptoms of preeclampsia, you need to contact your OB provider or your local birth center right away. And finally, let's talk about the importance of mental health during pregnancy. Did you know that 10 to 20% of pregnancies are complicated by mood disorders, such as anxiety and/or depression, and that if left undiagnosed or improperly treated, that can increase your risk for developing postpartum depression, as well as long-term complications for you as well as your baby? So here are the symptoms to look out for. If you feel constantly worried about the well-being of your baby and your ability to parent, if you can't stop crying, you wish the world would go away. If you are feeling hopeless, helpless, a lot of guilt. If you have any thoughts of harming yourself or someone else, please contact your OB provider. That being said, here are 5 simple steps that you can take that might help alleviate some of your symptoms. Number 1, talk to somebody, your partner, a friend, a family member. Number 2, focus on self-care. Get plenty of rest, eat a healthy diet, and use those relaxation techniques. Number 3, avoid the use of alcohol and/or street drugs. Number 4, talk to your OB or your midwife about your concerns. They may be able to refer you to a behavioral health specialist, or they might start you on medications that can help get those moods under control. And finally, number 5, if at any time you are having thoughts of self-harm, please go straight to your local emergency room for evaluation and treatment. I do hope that this information has been helpful, and that if you have any questions, you'll leave them for me in the comment section below. And while you're in that comment section, I sure would appreciate it if you'd hit the like button and/or feel free to share this video. Hello, it's CJ. Thank you so much for watching the entire video. I truly do hope that the information has been helpful. When I make these videos, it is not meant to replace a visit with your healthcare provider. Rather, my hope is after watching my video, You know what questions to ask your provider at your next visit to best meet your own healthcare needs. In the meantime, if there's any questions that I can answer, I hope you'll reach out to me. And finally, if you have not already subscribed to my channel, I'd really appreciate it if you did that. That's all I have for today. This is CJ, and I am at your cervix.